All right, my clock shows that it is 10 o'clock this morning. Good morning, everyone. Thank you so much for joining us for this year's GPS Navigation for Caregivers conference. My name is Rob Fabian, and I'm the Director of Marketing and Communications for Age of Central Texas. We're a nonprofit organization here in the area, homegrown, to help older adults and family caregivers to thrive. And we are very, very excited that Sharon Butler and the Riverbend Church asked us to join this year and help to present this year's 8th annual GPS Caregiver Conference. I'm going to ask Sharon to join us, please, and for her to unmute and to show herself. Hello, Sharon. Thank you so much. I'm going to throw it to you for just a few minutes. Tell us about the GPS conference and the church, and give us a little bit of background of why we're here this morning.
Okay. Well, I want to welcome everyone here on behalf of Riverbend Church. We have been so fortunate in delivering this information to area caregivers for the past 7 years. And as Rob said, this is the 8th annual event. This is our first virtual event, so I hope you will bear with us as we kind of work through these little quirks and get everything set up this morning and through the week. We have some exciting things going on at Riverbend for caregivers. We have a support group that meets once a week on Zoom, and we also are in the planning stages of a once a week free respite program that will hopefully start at the end of this year, sometime if the pandemic allows. There will be information on those two things in your virtual program and also in the survey that you'll be given at the end of the week. So if you're interested in either one of those things, we would love to have you participate with us. I've lost my train of thought. I'm so sorry. We're really happy that you're with us today. We're glad that we can continue to bring all this good information to you. As caregivers, this can be a very difficult journey, and Riverbend is all about inclusion and encouragement, and we welcome you to go to our website, riverbend.com, and see what's going on and see how we can be of help to you. So if I may, I would like to offer a quick blessing as we begin our week and begin our day. So Father, we thank you so much for the opportunity to be able to use our technology to stay in touch and to support and encourage one another. This is a hard journey that we're on, and you know that we're doing the best that we can, and we ask you to be present with us and to guide our steps along the way. And this morning, as we learn about in-home care, those who are caring for loved ones at home have an especially difficult road. Lots of fear, lots of challenges. So work with us, help us, give us the information we need to do the best that we can. In thy name we pray. Amen.
Amen. Thank you so much, Sharon. Really appreciate that, and so appreciate everything that Riverbend Church has done for the community for so many years. They are an amazing partner with the community and with caregivers throughout all of Central Texas. Another amazing partner that we have here in Central Texas is Cindy Cummings. She is with Turnkey Transitions and Cummings Home Team. She is a wealth of information knowledge on the community, and we are so glad that she is our main sponsor for this year's GPS conference. So Cindy, I want to throw it to you. Tell us a little bit about your company and the services that you offer.
Well, thank you so much. When the opportunity arose that I could become a presenting sponsor, I jumped on it because I have been So proud to be a part of the GPS conference since its inception in many different ways, both as a vendor, as a speaker, and just supporting the event. That when this opportunity arose, I jumped on it. I was so excited to be a part of it. And I am a realtor. I've been a realtor for 20 years now. The Cummings Home Team, we have 40 years of experience. The Cummings Home Team is a family-based real estate company. We work with Realty Austin. And one of the unique things about us is we offer an additional ancillary service. It's called Turnkey Transitions, which is move management. And move management helps people when they're making a transition from their home to another smaller community or to move in with family members. As you can imagine, it's complex when you're moving from a residence that you might have been in for 50 years or more. And we are a concierge service, and we come in and we are a one-stop, one phone call that you can make to get it done. We've helped all different kinds of families. Sometimes we're helping the adult children. Sometimes we're helping the actual owners of the property. But our services help from the very beginning to the very end. You don't have to worry about calling 15 people to get things done. You just call one number and we get it done for you. So we're really excited to be in the Austin area. We are the only realtor that offers move management, which is the official term for it. We are a member of the National Association of Move Managers. We are specially trained to work with seniors and with their families through the complexity of it all. So again, I'm just so proud to be a part of such an amazing event. And I know that the information that will be shared every time we have an event like this, the information is so critical and so important, and it helps so many people. It gives me goosebumps just thinking about how we might be able to help caregivers in the Austin area. So again, proud to be a sponsor and can't wait to hear and learn like everybody else this week.
Thank you so much, Cindy. And we thank you so much for everything that you do in the community as well. You and I met when I first started with AGE 7 years ago. And I know that you had been doing quite a lot in the community before that time period. And I have learned so much from you and have really enjoyed working with you over this time. Another person that I have loved working with is Mike Gill over at Texas Senior Living Locators. He is our session sponsor for this morning. And he is another one of those amazing experts that we have here in our community. So Mike, I want to give you a chance to talk about your amazing work and your wonderful business as well.
Thanks, Rob. As Rob said, my name is Michael Gill, and my company is called Texas Senior Living Locators. First thing I'd like to say is thanks to everybody here at GPS. Sharon Butler is a volunteer. Rob is with the nonprofit. The people that work on this conference, there's so much that goes on behind the scenes, and there's so much work and love and respect for the elders that goes into this that we all need to give them a quick applause and thank you, because they do a great job putting this together. I've been involved with the GPS since it began also, and I've been a speaker just like Cindy has been. So where do I fit in this whole circle of life here in the elder care industry? Well, you're going to be hearing a lot here at the GPS conference, everything from home care, which is what Jennifer Prescott does, all the way to lawyers and other types of people, move managers like Cindy and realtors and things like this. It's a big universe of people that helps the seniors. So when you're thinking about moving from home, now, one of the things, you can stay at home for as long as you want. There are 3 different services that help you stay at home. The first one is the home health, which is paid for by Medicare. The second one is the home helpers, such as Jennifer, and the third one is hospice. When it is time to move, there's 3 reasons you have to move. Number 1, you need to move from home if you're unsafe to yourself or somebody else. Frequently, this is somebody with dementia who could wander outside or leaves the stove on or something along those lines. The second reason you need to move is if you'd be healthier someplace else. Frequently, this is for somebody who is living alone at home, isn't taking their medications as well as they should, is doing a fair bit of self-neglect. And so if they do move into a senior living community, in that case, they'd be healthier. And the third reason that people need to move is when there are caregiver issues. And that may mean, say, an 85-year-old lady who's been taking care of her 90-year-old husband, but because of her own health issues, she can no longer take care of these people. Or when the kids can't give enough help to their parents because the parents need help too often during the day and they've got busy lives. Or if you're in a rural area and you can't always get consistent health care or help at home. This last week for so many people must have been so difficult because a lot of caregivers just couldn't make it in, whether it was to the hospital, whether it was to assisted livings, or whether it was in to see their loved ones. So this illustrates the times when it is no longer safe to be at home. So that's where I come into the situation. When somebody wants to look for some sort of senior living, whether it's independent living, assisted living, or memory care, I'm the service that you come see. There are over 200 different choices of places to go in the Austin area, if you include skilled nursings. And I've visited every place in town. And I can help you figure out the differences between assisted living and memory care, and when it's appropriate to go to one versus the other, and what are all the nuances that go on and what you need to know. Now, before the pandemic, I would put you in my car and we would go visit these places together. These days, we're doing a lot of Zoom tours to start, and occasionally you can get into the community after you've made a decision to make sure things have gone well. But I can help you figure out other things such as, make sure that you have all your powers of attorney and things like this, making sure that you know about veterans benefits and long-term care insurance. At any rate, when it's time to go looking for senior living, I'm a one-stop shop. I've been doing this for 9 years. I can make it a much more efficient search for you. One thing you never want to do is put your name into the internet, because your name gets sent all over town and all over the country, really. And you're going to end up blowing up your email and your voicemail, and you're going to get so much unsolicited help that it's going to be much more frustrating. So never put your name into the internet. So at any rate, my name is Michael Gill. My company is Texas Senior Living Locators. It's a free service to you because I'm paid a commission by wherever you end up going. And I'm happy to talk to you about your loved one whenever the time is right. Thank you, Rob.
Thank you so much, Michael. And Michael is one of the leading experts when it comes to this Central Texas area. So be sure that you contact him, because as he said, his services are free to you. So utilize those services. Before we get started with today's presentation, I want to go over just a couple of little housekeeping items. Number one, I want to let you know that we are recording this session. So if for any reason you have any technical issues, you get knocked out of the session, don't worry. We're recording it and we're going to be posting it on YouTube a little bit later today. And we're going to send you an email with that YouTube link. We're also going to send you the PDF of Jennifer's presentation for this morning. So you'll have that. So you'll have be able to look back at that and see everything that she presented for you this morning. Speaking of technical issues, this morning has been a great adventure for several of us trying to get into our Zoom. Here at the H building, we lost power for quite a number of days, and our computer systems are still technically down. So through a little bit of magic, I was able to get in. So if we have a few bumps along the line, please forgive us. We are kind of working the best that we can to be able to bring this presentation to you this morning. We are so thrilled so many of you have been able to join us this morning. And we had told you that we were going to send you the program. And as Sharon mentioned, we are still working on that. Again, technical issues of this past week have kind of thrown a wrench into all of our plans. So we're finishing that up, and we're going to be sending it to you here, hopefully by tomorrow, if not by Wednesday. In the program is going to be lots of great information. You'll have not only the bios for all the speakers, you'll have lots of great information from all of our sponsors, including Cindy and Michael. And so be sure and take a look at that. We're also going to include a lot of caregiver resources for you. So we're going to have a lot of information that you can utilize immediately in your caregiver journey. Finally, want to tell you about the chat feature, because as Jennifer is doing her presentation today, we want you to ask questions, because at the end of her presentation, we're going to answer all of your questions. So right down here, there is a little symbol. It looks kind of like one of those thought bubbles that you see in the comic strips. That is your chat feature. You click on that and then just type in your questions. We're going to be moderating the questions while Jennifer is presenting. And then when she is finished, we are going to go back and answer your questions. Now, we've allotted about 20-25 minutes to answer questions. So if for some reason we run out of time to answer the questions, because we want to be cognizant of your time, we said we were going to stop at 11:30, we're going to stop at 11:30. If by chance we don't get to your question live today, don't worry, we are going to answer your question personally. We will email you with the answer to your question. So please Ask those questions because this is for you. That's why Riverbend Church has been doing this for 8 years, is to provide you with expert information to answer your questions, to connect you with those experts who can help you in your caregiver journey. All right, we're ready to go. It is my pleasure to introduce Jennifer Prescott to you. She is our presenter this morning. She is the founder of Blue Water Home Care. She's also a registered nurse, and she has 25 years of experience in nursing and clinical operations. She has a master's in science from nursing from Duke University, specializing in healthcare leadership, and a bachelor's of science in nursing from the University of Delaware. She serves on the executive board for the Capital Area Parkinson's Society, and she's vice president of outreach and support groups. And she has previously served on the executive board for the Alzheimer's Association Central Texas, and she is also a certified dementia practitioner. She is a wealth of amazing information. And Jennifer, we are so glad to have you with us this morning. I'm going to turn it over to you and let you start your presentation.
Wonderful. Thank you. Thank you. I'm going to share my screen, y'all. Let's hope it works. All right. Success? Just making sure. Can everybody see my screen? Just give me a yes, since I can't see all the chatting.
You are perfect.
Awesome. Okay. I'm going to put on my slideshow and we are going to rock. Okay. First of all, thank you all for being here. And I feel so blessed. I am a caregiver myself. I can tell you I'm going to bring this. I did not think that 3 years ago when I got this in my stocking from my husband, because if you ask my husband, I'm not a camper. I thought you only use these headlamps for camping. Well, I can tell you that I remembered about this when we didn't have power and all of the rolling blackouts. So I am very blessed to be here. I am so grateful that each one of you are on this video call right now. I think that this has been a challenging time for all of us. And I can tell you even more of a challenging time for those of us, me included, and I'm going to tell you my story, that are caregivers. So I have been a registered nurse for the past 25 years, and actually 26 years. This will be my 26th year, and 25 out of those 26 years has been spent in senior care. I have a love and a passion for taking care of seniors and helping them. And now I have the ability to take care of my mother-in-law with early stage dementia who lives with us. So I am indeed living the walk that many of you are walking. I have 4 children. We have an 8-year-old to all the way up to a 19-year-old in college. And my husband and I have a business, Blue Water Home Care, and we are taking care of my mother-in-law and also a cute little basset hound named Molly. So I probably should have made a picture of Molly as well because she's super cute and she makes you smile. So here's the first thing. I know many of you feel like, this is kind of like, what do I do? What have I gotten myself into? Can I handle this? This sort of photo represents the way many of us feel on a daily life. We feel frustrated, we feel confused, we feel excited, we feel angry, we feel passionate about, we feel led. But what's happening right now is I think that adding with COVID, and I think now with, they're calling it Snowvid 2021 or the snowpocalypse, I think many of us just feel like enough is enough. And I can tell you that many of us are feeling that way. Just because I'm a professional doesn't mean that I'm not a human and that we're not feeling the same way. So one of the things that I wanted to just address is that, the total population in Texas, ages 60 or greater, has gone in 2010 up to 2050. We're going to be at 12 million Americans by 2050 in Texas. So we are one of the fastest growing states when it comes to seniors. And so we are so lucky, and I have to tell you, I've lived all across the nation. We are so lucky and blessed to have Riverbend and Age of Central Texas to be able to support the caregivers in our community. I want everybody, please, this is just from my heart to yours, and I know everybody on this call, if you are struggling with things, if you need water, if there's things that we can help you with, I know that our church also has been helping. I'm sure Riverbend has. We've been connecting a lot of people. So please add in the chat box, like if you need something, if you need trees brought down or whatever, and you don't have the financial resources or whatever it is, please put in the chat box if it's something that we can help you with as a community. I have seen the community come together so much during these really trying times, and especially over the past week. So please do me a favor. If you're struggling with something, you need a prayer, you need food, you need water, please do me a favor and put this in the chat box. I'll make sure that Rob, gets that stuff to us, and I'll, connect up with people that I know, because it's really important that we really do help and support each other. So as I talked about, the Austin metro area is one of the fastest growing populations of older adults and the fastest growing population of age 55 to 64, according to the US Census Bureau. As we know that our population is living, we're working longer, as well as, the services and the infrastructure to be able to ensure that we all have our own physical and mental and emotional and financial well-being. And I can tell you personally that, many of us, these things have been trying times. And so we've had to lean in our family and our faith with a lot of the frustrations that we've been seeing. So today, the purpose of my talk is talking about effectively utilizing in-home healthcare. So we're going to talk about, what are the types of in-home healthcare? How do you choose the type and what is, appropriate and maybe not appropriate? We're going to talk about identifying when someone needs care. And I think that's when a lot of us are in these, situations. We don't exactly know when is it time to pull the trigger. And I can tell you, as a daughter-in-law, even a company owner that does this work, my husband and I still wonder, and I'm going to tell you some more stories about sort of what we've been going through to hopefully help you as well. We're also going to talk about choosing a provider. What does that look like, whether it's a hospice provider, a home health provider, a home care provider, or someone that helps with palliative care. And then, of course, we're going to have questions. So what are the 4 types of in-home care? So those are home care. So that's typically considered non-medical home care, and we're going to talk about that. We have home health, which is more from a Medicare, a Medicaid, and a private insurance perspective. Hospice, which is again Medicare, Medicaid, and private insurance. And also they do provide some free care as well. That is required if you are a participant for Medicare funds. And then what is palliative care? And it's important to know that sometimes, you may have a couple different services in one, taking care of one individual. So let's talk about home care first. So what is the payer source of home care? So the majority of the payer sources for home care are private pay. There's also opportunities for Medicaid as well. So if you are on a Medicaid waiver program, there are some agencies that do provide non-medical home care. So what we're talking about that is paid for, and it's usually a portion of that's paid. So they may tell you that we will approve you for 20 hours of care or 15 hours of care. And those are through like Medicaid or Medicaid waiver programs, Star Plus programs. That's when you would want to get in touch with the Medicaid program within the state of Texas. And so that's a state-funded organization. And that is based on how much money you have. And so that's important, that if that's something that you feel like you might qualify for, you would want to get in touch with them to see if you would qualify for that. There are some Medicare programs that actually do provide non-medical home care. There's not that many of them. And there's also not that many agencies at this point that actually are contracted with them. So that's one of those questions that you want to ask when you are working with standard Medicare. Doesn't do that. But if you have one of the specialty Medicare programs, you would want to call their customer service number and ask them. Also ask them for a list of providers, because it's very important that you have a list of providers, because those would be the providers that were actually contracted with that insurance company. So again, those 3 things. So private pay, Medicare, some Medicares, not all of them. So if you have Medicare Part A and not a specialty program, they will not pay for it. and then some Medicaid programs. So what are the services provided in general? We're going to get into some of the nitty-gritty, but from a general perspective, the home care provides bathing, dressing, grooming, meal preparation, laundry. We do things like pet care, taking pets for walks, doctor's appointments, errands, those kind of things, and also medication management. And what that really means they can do is they can actually do medication reminders. And so what that looks like for medication reminders is that you would have a MediPlanner set up. Usually the family sets that up, or they might work with, which I absolutely love, and if you haven't done this, I highly recommend it, working with like pillpack.com, there's lots of them out there. Well, they'll actually send your loved one little packets of it'll be little packets of their pills, and they'll tell you like, today is, I'll make it up, March 1st, morning medications, and it'll give the list of medications, and it comes in like a spool, and then the person pulls it out. Now, of course, and then the care provider can come in and do a medication reminder and make sure that that individual can pull that out and take that medication. I can tell you the state does not allow non-medical agencies to actually open up pill bottles. So it's important that those pill packs either be pre-done by the family in a medication planner, or we can use pillpack.com or another company. There's also some machines that you can use as well, which can be very helpful. And if you've got more questions about that, just let me know in the chat box and we can get you more information on that as well. So length of care and service. So for home care, folks tend to be on service. Like I can tell you, our average length of stay for days is about 280 days of service. So it's pretty long. Folks tend to maybe have a short-term incident, or maybe they have a broken bone and they need some help, or maybe it's somebody who has dementia, Parkinson's, and someone who's trying to age in place. We're able to keep them, at home longer. But that's but we've got clients that have been on service for 3 years. So that is very possible as well. So do you need an MD or a PA or a nurse practitioner order? The answer is no. So you do not need to have an order. And the reason for that is because it's non-medical. Now, some providers, when you have a payer source of Medicare or Medicaid, they may require that. So that's all based on those programs. So just keep that in mind. Who provides care in home care? So the people that are providing care. So the state doesn't require that someone be certified to provide care. Our agency, about 40% of our caregivers actually are certified nurses assistants. And that's one of those questions that you want to ask. But with that being said, some of our clients don't need to have a certified nurse's assistant. They just need someone who needs meal preparation, companionship, laundry, grocery shopping, errands, taking to doctor's appointments. And that doesn't require someone to have a degree or a certified nurse's aide to do that. So the next one we're going to talk about is home health. And that's probably one of the most common that many of you already are aware of. So who's the payer source for home health? The payer source for home health is Medicare Part A. And also it is Medicaid. So those are the two payer sources, also commercial insurance. It's very important when you're getting a referral that you make sure that you are aligned with the payer source. So every payer source will have a relationship with some companies. So you may get a referral to someone and they may turn around and not accept that. So it's important when you're making your decision that you know exactly what your insurer actually is contracted with. That's very important. Because you don't want to be stuck with a lot of additional copays and all of that. Now, the percentage of what is paid is really based on your insurance. Typically, there's potentially a 20% copay. It just depends on your insurance. So that's important that when you sign up for an agency, you want to ask them, what am I going to need to pay? Some companies, they don't bill anything else. It just depends, and it really is based on your insurer. So services provided. So who is on the team? Nurses. Usually there's a social worker. The nurse case manager will come out first. You've got a physical therapist, an occupational therapist, a speech therapist. Sometimes there's a home health aide as well. And we're going to talk a little bit more about that in length as well. So the big thing is, what's the length of care? I can tell you there's been a lot of changes over the past really 3 years with home health. I can tell you from the home health perspective, the visits are usually front loaded. So what that means is they have more visits in the beginning of their benefit period, and then they start to go off. Usually those visits are about an hour, and the nurse will come out first and do an evaluation, and there needs to have a skill. So it needs to have something, whether it's wound care or something that nurse can help you with, blood pressure issues, medication management issues. You may also have, they may identify that, physical therapy is going to come out. So you may have had a fracture and you need some physical therapy. Occupational therapy is who helps you with things like your activities of daily living. So teaching you how to get back to your normal, your baseline, your independent. So that could last, I've seen it last a few weeks to a few months, but I can tell you that, home health is not something that lasts forever. And so these agencies need to show to Medicare that you actually are improving and you have a skill. And so if they can't show that, then they're going to need to discharge you. Again, yes, you do need an MD order for this 100% of the time. And I can tell you that the home health agencies now need very, very strict notes that support the reason why somebody needs home health care. And so you may see a delay if you're noticing that you do need home health care, or maybe you went to the hospital or your doctor said, hey, you need home health care. There might be a delay because if the doctor hasn't seen the person in the past X amount of time, you're going to need to get in to see that doctor or do a virtual visit. So keep that in mind and maybe give a little bit of grace sometimes to these agencies, because sometimes they're waiting on the proper documentation, and I know it's getting much more strict and stringent from Medicare. And then who provides the care? We already talked about that. The nurse, sometimes they have a social worker. You may get a certified nurse's assistant, or you may not. Don't bank on that. Usually it's maybe a couple visits, but that's really not what they're geared towards. They're geared towards giving you more skilled need. So let's talk about hospice. So I worked in hospice for 15 years. Hospice is my love. It's my passion. Love caring for folks at end of life. And that's one of the things that our company does, is a lot of end of life support. So who pays for hospice? Hospice is paid for identical, the same as home health. It's paid for by Medicare, Medicaid, and private insurance. They also have a requirement that they take some non-pay patients, so charity patients. Services can be provided. So what do they provide? They have a nurse case manager, they have a physician, they have a chaplain, a social worker, a home health aide. And we're going to talk a little bit more about that, a bereavement coordinator, which is so very important. So in hospice, what you do is you have the client and the family in the center, and then you have the whole care team around that. So the length of care. That's really when folks have 6 months or less to live. But what I can tell you is that doesn't mean that person has to pass away within 6 months. And we're going to talk about a little bit more about that criteria. But just so that person is declining, they can continue to get certified by Medicare or Medicaid for that matter. Do you need, so what's the length of care like we talked about? It could be anywhere from days, which we always hope not, because that means we got hospice too late, all the way to years. I can tell you that clients that have cardiac issues, respiratory issues, they've actually done studies to say that when you're on hospice and you have cardiac or respiratory issues, that you actually live 81 days longer on hospice. And I think that's because we're really focused on supporting them. We're able to, see them more often than they are able to go into a doctor's office. And we definitely see people do really well on hospice that have those diagnoses. Do you need an MD order? Yes, you do. But with that being said, is if you don't have a physician, for example, and maybe you've just moved to the area or you're watching from a different part of the country, you can actually call the hospice, and sometimes they'll send out a hospice medical director or a nurse practitioner to evaluate you, and then you can get an order that way. Not all companies will do that. So I would say if after the presentation, if you're seeing that, maybe you think you may need these types of services, I would reach out to the local providers about it. So the next is palliative care. And so palliative care is something that you can have. It's usually paid for by it's like a regular kind of a doctor's visit kind of thing, but they do it in the homes. They are some places, I know UT used to have a palliative care. I think they still do. They may not be doing much. It might be virtual right now, but palliative care is really focused on pain and symptom management. The goal is that people can live their best life. They can continue to have any type of other services. It's just an extra level of service of people that are specialty is pain and symptom management. The services that they provide, usually you'll see a nurse practitioner or a physician come out to the home, do an evaluation. They may do it virtually, and they'll help to tweak medications in collaboration with their primary care physician, or maybe their oncologist or their cardiologist or their pulmonologist. They'll work together as a team, because the palliative care folks are the ones that really are the experts in this area, and they help to, guide the other physicians. It tends to be a really good relationships. And I can tell you the other physicians really like it because they get to work with someone who's an expert in that field. That person can continue to have, therapy. They can continue to have, chemotherapy. They continue to see their regular doctors. That's not a problem. The length of care, really for that could be everlasting as long as that person needs that. It's not something that has to be stopped at any given point. Do you need an MD order? Yes, in order to, you'll need an MD order, but typically they'll come out there and they'll take care of that for you. So you don't need to have an MD order ahead of time for that. And who's the one that provides care? Typically it's a physician or a nurse practitioner or a PA, depending on who's on that palliative care team. They also sometimes do have social workers involved, which is very, very, very helpful. And they can help to navigate the process with you and connect you with resources. So how do I choose what type of care is needed and when? So I'm going to talk about a case study number 1. So I'm going to read it for you guys. So Marla is an 89-year-old female widow with mild cognitive impairment. She lives alone. She's able to drive. She's going to and from church. She goes to her doctor's appointment, goes to the grocery store, cooks her meals. Well, she had a fall during the recent snowstorm and she fractured her left foot. Her family lives close, but they have 4 children. They have 2 full-time jobs. And what kind of services do you guys think that she might need? So I'm looking to see if I can see the chat box. I don't know if somebody can look at the chat box or someone unmute themselves briefly. Anybody want to jump in and tell me if they have an idea of what services that this person could potentially need?
So home health care is the answer that we are getting, and home aid for meals and for bathing and grooming.
And yes, so it's probably 2, you're right. So home health care is absolutely right. So home health care would be something that can help her with, because we already talked about it, physical therapy, occupational therapy. So again, occupational therapy is really based in how to get people back to their norm. So for example, she needs to take a shower at some point, but she may need help putting on something to cover, like if she has a cast. So it's really important that occupational therapy can help them with that. Maybe she needs a shower chair. And it's important that you just don't go buy a shower chair, because there's different kinds of shower chairs. There's shower chairs that go right, where you, sit them in there. There's some that go half in and half out. There's some with backs, some without backs. And that's why I always look at, making sure that our home health team can help us with that, because I'm not an expert in that area. They can also, the other thing as you guys were talking about was home care. So that's non-medical home care. So that non-medical home care agency could help her with safe bathing, safe dressing, making sure she can get her, meals taken care of. Because if someone's broken a foot, she's at risk of breaking a hip if she's walking around with a broken foot. So home health could help with bathing, dressing, grooming, meal preparation, making sure she has medications, making sure she gets to her doctor's appointments. As a daughter, we talked about, I have 4 children and we're taking care of my mother-in-law. And I can tell you, when you become a senior, there are so many doctor's appointments. I am sure, gosh, I don't know if it's not like we have Facebook, but if we had a harder like of everybody who feels like seniors have so many doctor's appointments. I mean, it's a hearing aid, an eye doctor, a primary care doctor, a specialist. I mean, it's insane. So if Marla, who we're talking about is the 89-year-old female widow that just broke her foot, she's going to need to go places. And I think, this would be a great opportunity for a short-term home health and a short-term home care agency to help her. And it might just be, 2 or 3 weeks or maybe a month, but, their family will feel comfortable and feel like she's safe. She's going to feel like she's well cared for. And we just don't want her to be losing weight. We don't want her to be, eating poor foods. We want to make sure that she has proper hydration, because it's one of those things, when we become older, one little thing can make a huge situation occur if we don't take care of it from the beginning. So next is going to be case study number 2. So John is a 76-year-old man with Parkinson's disease that's advancing. He's having new swallowing issues. He's falling more than he's usually done. He has lost 50 pounds over the past year. His wife has to have surgery in March and needs help. What kind of services do you think that he could potentially need? What do you guys think? There's a lot of answers to this one. Anybody have an idea?
We've got palliative and home aid to help with the daily living, home health, and home health combined with palliative care.
I love it. All of those are good. Really the truth is probably potentially all of the services could be utilized. So first thing would be home health. And the reason why I think that is the swallowing issues. So one of the normal things when somebody has Parkinson's is as the disease progresses, someone actually may have difficulty swallowing. And so there are speech therapists can actually do swallow studies in the home, which is fabulous, especially with COVID. And if somebody hasn't gotten their COVID vaccinations yet, or they just don't feel comfortable, they actually have the ability to send, they could do swallow studies. There's some tests they can do in the home. And then a speech therapist could help with that. That would be home health. Home care, obviously you're going to need some type of home care. That's kind of a non-negotiable unless there's a family member that could potentially come in. Because what happens is when someone has surgery, and I think, as caregivers, we want to think that we're superheroes, but the truth of the matter is at some point we all hit the wall. Like we just do, we all hit the wall. And we're not perfect, and there is no perfect. And so sometimes we need to use services. And the good news is, like with a home care agency, you could use those services for, a week, 2 weeks, a month, 2 months. Now, with John, with his advancing Parkinson's, he may also need palliative care. There might be a situation like he's got, symptoms that because of his swallowing issues, he's having pain or he's having whatever it is. So palliative care, absolutely. Down the pike, he probably isn't there yet. I did kind of throw in the whole 50-pound weight loss. So that is one of the things that we're going to talk about that you want to look at for hospice. I'm not saying we need to jump into hospice at this point, but that's just one of those things when you have somebody with a significant weight loss. My guess that John's weight loss is probably related to his swallowing issues and him not have the right consistency of food. So you guys got 100% on this one. All right, so when is it time for care? This is any type of care. The first thing is after an emergency room visit, after a hospital or a rehab stay. So a lot of times, and I can tell you right now, it is really challenging. There are so many people that are going to the hospital and the emergency rooms. These folks are having to get in and get out very quickly. You may or may not leave with all of the services that you need, which is why this is so great that we're having this conference, because it's going to give you some information that you can use in the future if you ever are experiencing these things. If your loved one has a change in mobility, so what does that mean, a change in mobility? So that might be something where, they were, of course, falling. That's one of those things, because I don't know if you know that 1 in 4 seniors over the age of 65 has a fall. So 25% of seniors over the age of 65 have a fall. So we don't want that to happen. We don't want that to happen. A lot of people have a fear of falling. I can tell you that during the Snowvid 2021, my mother-in-law, we told her, because she lives like in a little casita on where we live in our property, we told her, don't go down the stairs and don't try to come up the stairs because there's 3 inches of ice. What does she do? Goes down the stairs and up the stairs. Thank goodness she's strong and she was able to get up the stairs, but that could have been really bad. That could have been a head injury. That could have been a fall. One of the things that happens with change in mobility is that people get depressed. People have emotional withdrawal. So this is one of those things that you need to think about. If a person is frail or non-groomed, and I think that's one of the things that as we are family members, and especially because I know that our business went crazy after the holidays, and it typically does, because a lot of loved ones were coming to see their family during the, the holidays, hopefully socially distanced and all of that, or we're just noticing a lot more calls to our office, and we're seeing that people are, frail, they're disheveled, their home environment. I mean, gosh, people, you may have a mother or that took impeccable care of her home, and you go into her home and there are piles of things on the kitchen table. The mail has not been taken care of. Maybe the electricity is not on. One of the things that we see are the smoke detectors are beeping. That's one of the big things. So look at the home environment of your family members or your friends that you're participating or helping. You could be just a volunteer that's going in there. Take a look at those things, because I can tell you that people get to the point where they don't have the energy to maintain their own home. And that is a very, very real. The other thing is expired medications. We went into a home 2 weeks ago. Family asked us to come in, went into the refrigerator, and I mean, there was stuff from 2015 in there. There were cans in there, from 2016 that we had to take care of and throw away. So it's important that you sort of look at the full environment, and it may not be that that person is lazy. It might actually just be because they're declining and they're not doing well. One of the other things is weight loss. And so, some of that unexplained weight loss may be something, they may have an actual physical thing wrong with them. They may have memory impairment, which is very common, depression. Right now, I mean, there's an astronomical number of people that are depressed at this point. And this is absolutely, we've been dealing with COVID-19. Now we have a snowstorm. People are, people have their house, their water's coming down. I mean, they don't have a place to live. They're having to live, this is a very vulnerable time for people. And we just want to make sure that we're connecting with people. And so that might be something that they can't shop for meals. They can't prepare the meals anymore. Maybe it's not a safe situation. Maybe they know they can't stand up long enough. I know that when my mom, she had passed away, but before that, she could no longer stand. She would have to, use a rollable chair to get herself to, make meals on the stove. And so that might be happening with your loved one. And so we already talked about falls, a loss of a spouse. One of the things that happens many times is that one spouse may take over some of the main roles of the house. And so maybe it's, they take care of someone passes away and they take care of, the bills. And that's one of the things that we see a lot, as we age, it gets very confusing. You start getting bills from people, people get taken advantage of. So it's important that, when someone loses a spouse, that we sort of lean in and just make sure that they're okay. Are they getting their medications? Are they going to their doctor's appointments? Are they getting, medications? Are they getting meals? Are they being prepared? Are they able to prepare them? So, and also their household. So I know that, it's just a time that we just need to kind of look at these opportunities and see if maybe a little bit of help from like a home care or, home health care could be able to be potentially helping them. One of the things is unexplained dents in the car. And so what does that mean? So that may be telling you that when somebody has early stage dementia or they move towards the memory issues, they lose their sense of being able to see their peripheral vision. And so one of the things that we noticed with my mother-in-law was that we noticed that in the back of her car, she was running into things. And so that was one of the indication that probably driving was maybe not the best thing for her. And so that's just one of the things that we need to think about. So we've already talked about home care. It's providing compassion and help for seniors that help with the activities of daily living, transportation, medication reminders, or companionship. One of the things that came up, and I want to tell you a story, was just this weekend. So one of the things that we noticed is that my mother-in-law did a really good job of taking her medications in the mornings, but for some reason, she only took one of her pills in the afternoon. She had two that she had to take before bed. The one of them was pink and the other one was white. And so the problem was she could see the pink pill in her medication planner. She couldn't see the white pill because the medication planner was actually white. So one of the things that we did is we were able to talk to the doctor and move the PM medications to the AM medications. So she knew to take all of them at once. The other option would have been to change the color of the medication planner so that it wasn't white and she would be able to see it. But some of those things are important because it's important that sometimes we have to dig deep a little bit and we need to really make sure that our family, our friends are actually doing what they say they do. Because I can tell you, people are good fakers. Like we're all good fakers sometimes. Like it's one of those situations where we don't want to put our hand up and tell that we really need help. And sometimes as, an outsider looking in and when you're going into a person's home, and this is what I do. I just look around. Sometimes I don't even have to ask, but I can tell if I look on the kitchen table that there's, piles of, mail, and I may have a conversation with a daughter or a son, and I'm like, is this normal? And some people, that is normal. But if it's not normal for them, that's when you know that there's potentially an issue. So again, what does the care look like? We've got companionship, helping in bathing and dressing, transportation, laundry, help with bills. We talked about home health care being the team. So we've got RN, physical, occupational, speech, sometimes a home health aide. They may do wound care. Again, that's what the physician's going to order. And then the physician and the rest of the team is actually going to determine what type of care that you will actually get and what people are going to be there. So we already talked about that person needing an RN. They would need orders for that. The care is based on that physician order. And remember, that's short term. They're usually popping in for an hour. The nurse might be there 45 minutes, an hour. They're not going to help your loved one, stay a long time, not going to do a 4-hour or a 6-hour shift. That's not going to happen. Now, occupational therapy may actually ask to do showers when they're there. So that is one of those things that you could utilize occupational therapy for that. So we've already talked about hospice being for terminally ill people who we say to a physician, would you be surprised if somebody wasn't with us in 6 months? That can be provided in a home, a nursing home, a assisted living, memory care, an inpatient hospice, or a hospital. Keep in mind the last two, inpatient hospice or hospital, those are only covered if they have pain or symptoms that are not being managed. That's kind of a crisis care situation. That's an elevated level of care. Medicare will not pay that for a standard care. They won't pay that if somebody is just actively dying. So keep that in mind. So we've already talked about what does hospice look like? Who are the people? And we've talked about hospice being intermittent care. So it's very similar to home health. They're going to be a maximum of maybe a 1-hour visit. You will get a home health aide with hospice, and it might be 2 days a week, 3 days a week, 5 days a week. It really depends on the situation. Palliative care is focused on supportive care with pain and suffering, and the person may or may not be treated for a terminal illness. You do not have to have a terminal illness in order to be supported with palliative care. And that's usually at the home, like we talked about, and that's where they're going to manage those symptoms. So next, I want to talk to you about choosing a provider. So this is important for all the types of providers you're looking at. If you also look on our website, we have, and I could probably give the link to Rob, we have about 20 questions. I put it down to, I think I did, yeah, I put it down to 6. Oops, sorry about that. Let's go back. Okay, I only did it to about 6 questions for right now. These were kind of the 6 most important questions. So how does the provider select and train employees? I think it's a very important question to ask this. Do not assume anything. So dig deep on the questions when you're interviewing companies. And this doesn't matter if it's a home health, home care, palliative care, or hospice provider. You want to find about background checks on the staff. So one of the things in the state of Texas, at least for non-medical, is that it's required that they do a state background check, but it's not required that they do a national background check. And so there's many agencies like ours that do national background checks. So it's very important that you actually specifically ask, because we have people that may have lived in New York or California or Arizona, and we just want to make sure that their background is clean. One of my favorite questions to have people ask is, what background findings will eliminate a caregiver from employment with your agency? So the state of Texas, there's certain stipulations that they have in the state of Texas that allows you to not hire someone. But then there's some wiggle room. And so it would be, this is a very pointed, direct question for a provider, and you'd be surprised. I would venture a guess that many may not be able to answer this question. One of the other questions is, who provides the in-home assessment before starting care? Again, so in non-medical home care, it's not required that they have nurses on staff. Our company actually has 2 nurses on staff, and we're the ones that do the assessments. But it's very important. It doesn't mean that you have to have a nurse provide the assessment. However, I think it's very helpful. So someone coming in that's a nurse is able to sort of look at that whole biopsychosocial cultural person. And I think that's one of the opportunities that we have is when I go into an environment and I notice that they've had a lot of falls, or they're having swallowing difficulties, or they're having pain. My first indication is, how can we help them? But my second indication is, what community providers can we connect them with? We connect people all the time to Age of Central Texas. It's so important that people know what are the resources out there, because you'd be surprised, you know, many people don't know what they qualify for if they have Medicare or Medicaid. They just don't know. So do they have RNs on staff? Again, and what is that role of that RN? Is that an RN that just pops in, pops out, you see them one time and never see them again? That's very important to know that. If you're going to be in home health or hospice, again, you're going to see those nurses on a set frequency, and they will be letting you know what that will be. So the other question is, does the provider assign supervisors to oversee the quality of these individuals that they're visiting? We want to make sure, you know, what does that look like? So who is overseeing them? What is their credentials? What is their, you know, what is their experience? And so I think that's really helpful, because what we've noticed is that, you know, the state of Texas only requires that somebody come out, a manager every year to supervise someone. That's not what we do at our company. We're out there every 30 days or less. But that plan of care is going to need to change. And we all know that that changes quickly. And so we want to make sure that the care providers know exactly what is expected of them when they go out there. The other question, which I think is really important, is how do you manage call outs and late caregivers? And so there are many companies that they'll sign you up for services and they're not going to guarantee care. And so it's important that you have that question, that you ask the provider, because they may say, well, you know, if somebody calls out, we don't have any backups. Or the company like ours might say, well, we've got, 10 people on call. That's the backup system that we have. And so it's very important that you look at those, who are the providers and how do they manage? Because, family members really rely on the care providers that are coming out. And so it's important that we make sure that when people sign up for services, whether it's home health or hospice, palliative care or home care, that those people are actually going to come out and they're going to provide those services. The last thing I would say, which kind of number 7, which I didn't add, is really communication. Is how are they going to communicate to you? And I think that's really important, because having one person that you're communicating to as a care provider versus having like a family of like 25, it's really important that you designate one person as that person is going to be the one that we're going to be, do the major communication to. That will really help tremendously for any of your care providers. That doesn't mean if it's, if home health, hospice, home care, any of those care providers, having one person in the family be sort of like the center and then have them be the ones to communicate out. It makes it very challenging for an organization to have, 5 or 6 family members connecting with them. And I can tell you that things can fall through the cracks. So I think, what questions? I think I'm looking at the time, so it's about 11 o'clock. So what questions? I know we've got to have some questions. Looking to see, and I can stop sharing too, so I can see the questions.
Fantastic. Thank you so much, Jennifer. What amazing, incredible information. And yes, we do have some questions for you. One of our caregivers who's joining us today is asking about how they can have the conversation with their dad about home care. Says that dad has had falls. Dad's been in the hospital because of it. He's been spending a lot of money on those issues. And dad says that he doesn't think he can afford home care. But, we know the caregiver knows that he can. How do you have that conversation with your loved one about, we really need to talk about getting you some help?
Sure. And it's a hard thing. I understand. We've had to do it ourselves. It's challenging. So I think the first thing is try not to make it emotional. I would be prepared. That's the first thing. So kind of looking at the list of things that we've identified. So I'll give you an example. So you're going to be my dad, Rob. Okay. All right. Not old enough to be my dad, but you can be my dad. So, hey, Dad, well, I'm really concerned about you. I've noticed that you've had a lot of falls. You've had 6 falls in the past 2 weeks. You've had to go on a whole bunch of new medications. When I came in the house, I noticed that it was freezing cold. I noticed that you haven't been to the grocery store. Can you tell me a little bit about what's going on? And so you might tell me, I'm fine. I don't need any help. You're just worrying about it. I've been taking care of myself for 75 years. I don't need your help. And I tell you, well, Dad, I've actually been out there like every single day, sometimes twice a day for the past month. And I'm noticing that, you're not eating except for when I'm here. You are getting so weak. I'm pretty sure you must have lost. Your clothes are falling off of you. Would you be, and I can't do it. Dad, we've got 4 kids. We have a business. We're also taking care of, Mimi, my mother-in-law. For me, do you think we could at least have a conversation with an agency that might be able to provide a little bit of help, because really, Dad, it's really honestly more about me than you at this point. I love you. I want to be there to support you, but I just can't keep coming twice a day. You know, it's really too much for me, and it's impacting, you know, my life and my marriage, and it's impacting, you know, you. And I feel really bad, and I feel guilty, and I'm sorry. You know, I know that Mom died. I told her that I was going to take care of you, and you know, like, can we just do it in a way, like maybe we could just talk to someone, just talk to somebody. We don't have to sign up for anything, but let's just gather some information. We can just talk about it.
I think that's great advice. We've also had this conversation many times with caregivers here at Age of Central Texas. And I know personally, being a caregiver for my parents as well, that being the child, a lot of times it goes in one ear and out the other.
It does.
And it is so difficult to be the child who's having to care for your parent, because it's a role reversal now.
Yes.
And so that is very hard. So sometimes it helps if you have a third party to assist you.
That's true.
Your mom or dad's doctor, you know, have the conversation with them and say,
yep,
you know, we're at this point, he needs the home health, he's resisting it. Can you help me have this conversation with them?
Yes. I was going to say, and that's definitely step number 2. And one of the things that's helpful is have that doctor write a prescription, because I can tell you that, you know, folks in their 70s and 80s and 90s, they very much put a high level of respect, which we all should, with physicians. And so if that physician says, you know, you need to have this, they will comply. Not always, but they will sometimes, more than none.
Right. And also, you know, somebody that possibly another family member that they really respect, have them help with that conversation. We've also seen a lot of success in talking with their minister.
Absolutely.
And again, somebody that they would respect, and have the minister say, you know, I know this is something that you might want to think about. So, you know,
I agree.
And then of course they go, oh, sure, great, I'd love to do that. And as the caregiver, you know, you're sitting there going, I've said this so many times, why won't they listen to me? But sometimes it does take having somebody else to have that conversation for it just to kind of click with them.
I agree.
Another question, couple questions here related to that, being a long distance caregiver.
Mm-hmm.
One person in particular, their parent lives in New York, and they have set up the home health care for mom, but mom is fiercely independent and doesn't want the care provider to come in the home. And every day they have to go through the same fight of, you know, mom, this person's coming to help you. And then the paid caregiver comes and there's nothing to do because the mom won't let them do anything. How do you address that when you've got a parent who's just fighting you on it?
Had that happen before many, many, many times. So there's not a perfect answer. The truth is there's just not a perfect answer. I think consistency is key. Trying to get the person, so the person that's, you know, the client, the patient, try to get them on the page where they feel like they have a little bit of control back. So working with the agency and, you know, having like that manager come out and say, you know, so Sally was out here and, you know, how did it go? And she's probably going to be negative or whatever. You're going to need to have a good relationship with that local agency, because maybe they like Sally, but they don't like Susie. And so maybe Sally's only available 3 days a week, but that's okay. Or maybe we can change the hours a little bit to work with Sally's schedule, because I think it's really challenging, especially with people who have memory issues, lots of different faces. Like, it's really challenging for them. Sometimes people are going to be grumpy, you know, they just are. I mean, there are people in the world that are grumpy and they're going to be all the time. If you get to a point where they're constantly, I mean, we've had situations where people will lock the door. We've had to get locks. So we'll basically have to get a realtor, Cindy would know, we have to get a special different, you know, key combination to be able to get in the door. We've had people throw things at us. We've had people kick us out. There gets to a point when you sometimes have to say to them, okay, look, if you're not going to accept, and you have the physician on board, you can have, you know, your chaplain, pastor, whatever on board, you sometimes have to have sort of an intervention that says, you know, look, you know, Miss Jones, if you are not going to accept this care, then we're going to need to move you to an additional level of care. And that happens. And sometimes that is the best thing for that person. And it doesn't mean they have to go to a nursing home, because that's what, you know, 70, 80, 90s, they think that when you go away, you always go to a nursing home. It might be that they just can't cook. They might just need an independent living where they can go down, they'll have friends and they can cook. Or it might be they do need a memory care, or might, you know, maybe an assisted living. So I don't say strong arm them, but sometimes you have to do that. And then sometimes when we talked about getting like a geriatric case manager, you know, out there to do an outside evaluation to make sure that we have all of the information. And sometimes they have to, a family member has to take over, you know, and they just have to. And that's sad because there's a lot of guilt, especially because the person, you know, is local and they're far away from their loved one. So it's not perfect. It gets a little sticky. That's why, you know, working with Rob and his team to support, when you work with a good agency, they're going to support you through this, and they're going to help making the right decision for you. It's not easy. Like it just isn't easy. I know. Yeah,
There's not one roadmap on how to do this. And
no.
Unfortunately, got a couple questions here about social workers. You had mentioned geriatric case managers who are
Yes.
fantastic.
Yes.
How do you connect up with a social worker or a geriatric case manager so that you can start on this process of having somebody who can help evaluate what is exactly needed for mom or dad?
Great question. So feel free to call us. You can call our office. I know you can talk Age of Central Texas too. We can give you like a list of folks that we've worked with. I think, you know, you can Google search geriatric case manager. I probably would connect up with myself or Rob or, you know, Michael, connect up with us, because we can tell you, we know who we've been working with. I mean, there's a lot of really good agencies out there. Most of them have social workers. They also have nurses. Some of them have nurses, and they'll come out, they'll do an evaluation, an independent evaluation. They'll be able to see, you know, what is their mobility like? You know, how are they taking their medications? Are they able to drive? How's their memory? I mean, they'll actually do, you know, memory tests. They'll do cognitive tests. It's not like going to a neurologist, but it's sort of like a general. Then they can share that information with the family members. And it has been invaluable for me, especially when there's infighting with families. I mean, I'm sure there's 75 participants. No one on this family has ever had a disagreement with their sibling, right? No one. I mean, I know it never happens, because, right? It happens all the time. And I love using a geriatric case manager. You know, the cost for that's probably, I don't know, Rob, like for an evaluation, a couple $100, you know, for an evaluation, and then they charge an hourly fee. They can help with, you know, coordinating home care, home health, hospice. They can coordinate helping you find a place. They can have those conversations that are non-emotional from a professional standpoint. They are invaluable. We work with a lot of agencies, and they are invaluable.
And I also want to give a shout out to one of our sponsors and one of our partners as well, the Area Agency on Aging.
Yes.
The Area Agency on Aging with capital Area is the organization. It serves over several counties here in Central Texas. If you're not familiar with them, they are the pass-through money for the Older Americans Act. And so they exist to help provide resources for older adults and for caregivers. Now, there's an Area Agency on Aging in practically every major city across the U.S. The theory is that every square inch of the U.S. is served by a area agency on aging. The one here in the Austin area covers several counties. I believe down in Houston, there's 2 or 3 of them to cover the area. But you can always Google Area Agency on Aging and whatever town mom or dad lives in, and you can find the one that serves their area. If you're a long distance caregiver, that's a great resource to have, that you can connect with the area agency on aging that is near wherever mom and dad lives, and they can help give you the information on the services that are available. They have services they can provide as well. For example, the one here in Austin, if mom or dad needs a wheelchair ramp, here with the recent issues with the weather, maybe mom or dad fell and now they can't get up and down the stairs. Well, we need to have a ramp instead of stairs. They can help provide that. They can provide short-term respite for you as a caregiver. They have a lot of options that things they can provide in addition to the services of referral and helping you connect the dots. So they are a great resource for you to utilize. If you're here in Austin, it's the capital area, the area agency on aging of the capital area. And of course, you can call Age of Central Texas. We have a lot of resources. We have a caregiver resource center that can provide you a lot of resources as well. You had talked earlier about that shower chair, that shower bench for getting in and out of the shower. One of the programs that we have is a health equipment lending program. We loan durable medical equipment to anyone for free, no questions asked. All you have to do is call us and we will set up to get you the durable medical that you need. So that's a service that we have available. We were talking about palliative care and hospice care. We've had a couple of questions on this. Can you just very quickly, the difference between palliative and the difference between hospice?
Okay, so palliative care is really, palliative care is pain and symptom management. And so that is usually done by a doctor that specializes, nurse practitioner, PA that specializes. There's companies all over. I know that Hospice Austin has a great palliative care program where they specialize. It's a whole team that specializes in palliative care. So that person may be receiving services, maybe an oncologist, maybe they have chronic pain, maybe they're getting chemotherapy or radiation, but they're still struggling with pain or other symptoms, nausea, vomiting. So what we will do is we will work, with them. They'll do the palliative care. Then with hospice, the way hospice works is part of hospice is providing palliative care. So that's kind of in one thing. So the goal of hospice is, managing pain and symptoms at end of life, but you make a choice if you're going to have sort of caring to curing. So hospice is more on the caring side. So you're not getting aggressive treatment. You are not, going to your oncologist anymore for, any type of infusions or radiation or whatever. With that being said, there are some times that you would have palliative radiation. So you may be on hospice, you may have a stage 4 glioblastoma, and you're having massive amounts of vomiting. It is possible for the hospice to pay for you to have palliative radiation to hopefully shrink the tumor just a little bit so that it's not pressing on a part of your brain that would make you, vomit more. That's not all of them. That's not all the time. So it's something that sometimes there's some treatments that they do when you're on hospice that are considered palliative. That could be really, helpful for pain and symptom management. Did I answer your question?
I think so. And also there was a question about what does Medicare and or Medicaid pay for in those situations?
Okay. So Medicare for hospice, it's honestly hospice, Medicare benefit for hospice, it's the Medicare benefit is the best benefit that Medicare offers. Hands down, best benefit. It covers nursing, social work, chaplain, bereavement coordinator, volunteer coordinator, home health aide. Hope I didn't miss anybody. It covers all of those services. So Medicare pays the hospice a daily rate to care for everything. There is no out-of-pocket expenses for the client. It also covers medication related to their primary disease process. So if they have cancer, it will be covering pain medication, nausea medication, anti-constipation medications, usually like GERD medications if you got, nausea, something like that. They're going to pay for all of those. They also are going to pay for all durable medical equipment as well. Keep in mind, so I want to just make this caveat, since I've run hospices for 15 years, if you're on like one of those fancy schmancy oxygen machines, I can't think of the name off the top of my head right now, but they sometimes won't provide them or they don't have them. So just keep in mind that you may need to make some, changes to like your concentrator or whatever, because once you elect the hospice benefit, that hospice connects with the other companies that they work with. So they'll cover all the medicines related, we talked about, to the primary diagnosis. You still, if you have Medicare Part D, could pay for your other medications that are not related. So like, let's say you're on a cardiac medication, it's not related to your hospice diagnosis. But when you have the admission of the hospice nurse, they will go over what's covered and non-covered. Make sure you have that list. And then you can either go to your local pharmacy to get the medications from the hospice, or you can do, they might be sending it to you in the mail. It just depends on the hospice.
Right. And also hospice can provide grief care for the caregiver after their caregiving journey ends. And so that's another tremendous opportunity there. Thank you, Roger, for that information, that reminder. Very quickly, how does a caregiver figure out what their Medicare and Medicaid that they have is going to pay for when it comes to home health? How can they take a look at what they have and say, okay, I know that my Medicare that I have is going to pay for this?
So you can go, to cms.gov, of course. That's going to tell you, what services. But if you have a specialty program, like one of those specialty Medicare, programs that are not just your standard Medicare, that's where you're going to need to call them directly. And you need to ask them. I know that there are some insurance companies that do not provide hospice as a benefit. So it's really important that when you're making decision making, and I'm a huge proponent, I'll tell you, of straight Medicare. I absolutely am. I can tell you the home health providers probably feel the same way, because then you kind of know what you get with straight Medicare, because every company is different. So if you have a commercial insurance, you can, call them, ask them what the benefit is. I think what's even more helpful is once you call the home health or hospice agency, they will actually check your benefits for you. Then they will call you and let you know, you're fine. And when you sign up for hospice, they'll tell you, hey, your benefits are 100%, there's nothing. Or they're going to tell you, well, you have a 20% copay. And that's part of the admission process. That benefits counselor can help you with any questions that you have. That's super, super, super helpful. And if you don't get the question you ask to speak to someone else. We really don't want people to have extra bills that they weren't planning for, but every insurance is different, and Medicare and Medicaid. Medicaid, when you have approval, there's, just so you know, there's community Medicaid, and there's also like nursing home Medicaid, and those are different. So I'm not an expert in that area, but just know that they are different. So if you have one type of Medicaid, that doesn't necessarily mean you have the Medicaid for your like nursing home benefits.
Right. And again, another shout out to Area Agency on Aging. They have benefits counselors who can help you walk through what your benefits are. And so and again, their services are free. So they are a great one to call and let them help you out with that. Quick question here, long-term care insurance, does that help pay for home health care, hospice, palliative, any of the things we've discussed today?
Yes, great question. Oh, I love that. I forgot to mention that. So thank you for bringing that question, whoever sent that in. So long-term care insurance is something that is very beneficial when it comes to when you are aging. So one of the requirements that they have most of the time, 99% of the time, is that you have to have 2 out of 6 ADLs that you need help with. So those things are like bathing, dressing, grooming, meal preparation. There's like 6 of them that you have to have. You have to need help with 2 out of the 6 of the ADLs, usually, in order to initiate. One of the things, like for non-medical, what we would do is we would come in, do our evaluation, and because an RN is doing an evaluation, We send that evaluation to the insurance company. You will call your insurance company and let them know, I'd like to initiate a claim. This is really important. You want to get that claim initiated. Then what they do after that and get a claim number, really important. Initiate the claim and get a claim number, write it down. Then you can let them know, I'm working with, whatever company that you're working with. And then they usually send a nurse out, or they're doing a lot of virtual visits now. They'll send somebody out virtually or in person to do an evaluation. Sometimes, like with our company, because we're have nurses, they look at our stuff and they're like, okay, well, you're an RN, blah, blah, blah. They'll just go ahead and approve it when we know that someone needs help. Sometimes there's waiting periods. A lot of times there's a 90-day waiting period. That's why it's important to get started sooner than later. There are many insurance company, long-term care insurance companies that also do cover, they give you benefits for home health. So even if Medicare is already paying for home health, they'll sometimes pay you an additional $150, $250 a day. Whatever your benefits are, it's very specific. I do recommend, if you haven't already, and those of you that have it, call your insurance provider. They give you a front page. Find out what your benefits are, because sometimes people have not been paying for the cost of living raises. And if you are paying for the cost of living raises, that can be really helpful, because as the cost of care goes up and up and up, it can really be helpful for you. So you can always feel free to give our office a call. I know we can always help you with something like that. We do take care of all of the claims, so we do all of the claims for the families. What ends up happening is you have to supply all of the notes, the clinical notes. Those clinical notes have to be sent bi-weekly to the insurance company for that client to get paid and reimbursed. So definitely love them. But the benefits are very variable. And so some cover some things, others don't. It really depends. So if you don't know and you haven't been in touch with your care provider, the insurance provider, please call them right away so you know what to expect as you're planning in the future.
Right. We've got about 5 minutes left, so I want to talk about some of the questions here we have about live-in caregivers.
Okay.
First question is there any recommendations or information on how to go about finding someone who would be a full-time live-in caregiver?
Sure. So there's a lot of ways to do it. You can go online and go to one of those general, you can Google it, go online, and there's lots of different companies out there that you can just go in and try to private pay and do that. There's definitely cost savings for doing that. The benefit of working with an agency is that when someone says they're going to be there, and if somebody gets sick, or I always say hit by a bus, then you've got backups that are going to be coming. So I do, recommend, talk to your friends, like talk to your church, your faith community, talk to, if you can find somebody that's local that or someone in the neighborhood that you trust that actually can provide the care. So that's one of the things that's important is, if you hire them privately, there's no indication as to if they're going to have the competencies to be able to take care of somebody long-term. So you have to make sure that person is competent. So do they truly know how to, bathe somebody? Do they know how to safely transfer someone? Because if not, you're left with the liability. There's nobody to train them. So I've heard great situations of people taking care of, private pay and doing live-in caregivers, amazing experiences. I've also heard nightmare stories. So it's kind of, it's not great. I mean, as soon as you go into the system, if you go into one of these, big box kind of systems, you're going to get lots of information. It's hard to weed through, and you think you get somebody really good, and there's a caregiver shortage, and that's just the truth of the matter. And we've experienced a caregiver shortage. There's a lot of education and training, and we hire a lot of people that are from our people that work with us. That's how we get our best caregivers, is ones that we've gotten that have actually, friends of friends that work with our caregivers. So it's possible you can do it. You will save a little bit of money, but it's really hard to find good caregivers. So it's,
And
and I
also,
think,
And also something that folks don't think about when they're hiring somebody is that your home insurance will not cover that person. So if they, strain their back getting dad out of the bathtub and they file a claim against you, your home health insurance doesn't cover you. You have to have supplemental insurance that covers them specifically. Also, if you're hiring that person, you're their employer, you have to file their tax info every year.
Yep.
And
Yeah.
That's a hassle that you have to go through. Is it possible though, if someone, finds someone they really like, they want to hire them to come move in, take care of dad, as a private person, can they do a background check on that person?
Absolutely. Absolutely. There's lots of companies out there. We use a company called goodhire.com. You can use that. There's a lot of agents, a lot of companies that you can use. I just recommend, there's also, this is actually free to anybody. You guys, it's just Google search, it's NAR, so it's a nurse aid registry in Texas, and EMR, I think it's like employability, something, I can't remember. If you need it, you can send me an email or we can get it to you if you need it, just let us know. These are two things that you can go in, anybody can do that. And just anybody can just Google it. And then you go in and you need to have certain pieces of information on that person. So that's in addition to a background check. Highly recommend it. I also highly recommend if you're going to hire somebody privately, don't just take their references that are like their friends, because their friends are going to be like, yeah, Jennifer's great. But I am, but you really want to get somebody professional that you can call on the phone and ask them, tell me about Jennifer. When's the last time that she was late for work? If they're going to give you just random, people that they know, I'm just telling you, it's not a good idea. So we dig really deep when people are applying for us. So I think it's a really good idea to do the same. There are labor laws associated with live-ins as well. I think you have to you guys are going to have to look into that, because I don't know all the labor laws for that, because we don't really do live-ins. We do shifts. But I know that there's labor laws that say you have to have certain amount of hours sleeping per day. So that's important as well, because if not, they can come back to the Workforce Commission and say that they're working more, and then you're going to be in a hill of beans trouble. And if you don't, if you haven't done your, there's just a whole bunch of stuff that you have to think about. There are agencies that will help you if you want to hire somebody privately. There are agencies to help you. There are sometimes we've actually had situations where we help care. I'm right now working with a family that wants to hire someone, and so they're working with us. We're helping them. We'll take care of it. We're going to do background checks, verify everything, make sure that they're competent, blah, blah, blah. And then they're going to hire them privately. And then they're just paying us a fee. So we've done that before.
And another great reason to go through an agency is that that they're bonded. That the person
that is true.
who's
yes.
going to be caring for your loved one has been vetted. They have been investigated. They are bonded. We're almost out of time here. I want to hit one more quick thing with you, and that's COVID. What are we doing in home health to ensure safety as we come into the home to take care of folks?
Okay, great. So the state of Texas has certain requirements. And so again, these requirements are going to be by licensed agencies in the state of Texas. They are required to do self-assessments to caregivers before they come into the home. They have to do a temperature check. They have to do symptom management check before they walk in. They have to document in their, we use our phone. They document in their phone. We also, the families need to do the same. So the families need to make sure that there's no symptoms of COVID, no one in the home has had it or been exposed to it. They also need to have temperature checks in the home prior to us, providing the care. So we ask that to be done prior. We do have some clients that we're going in, or home health or hospice would go in and they might not have done it yet. And so I can tell you for sure that those agencies are making sure that they're checking their temperatures before they start care. I do recommend 100% of the time wearing a mask. It's very safe. A lot of people haven't been able to get the vaccinations yet. I was blessed. I was able to get both vaccinations back in January. which I feel so much better about that because there's a lot of exposure out there. We've had clients give caregivers COVID, and it's been really scary, but luckily everybody's been okay. So I do recommend 100% of the time wear that mask. If it's not an N95, at least wear like a regular mask 100% of the time, and making sure that they're doing those self-checks every single day.
Fantastic. We are out of time, unfortunately. And so, Jennifer, I want to thank you so much for sharing your expertise and your information. This has really been wonderful. So many people in the chat box have thanked you for all the information that you have shared. We've got a couple of folks that had asked questions. We weren't able to get to those. And some of them were kind of personal. I want to let you know we are going to answer your questions. We're going to send you emails, and we're going to answer you privately via email, and we're going to help you with your journey. Once again, we want to say a huge thank you to Riverbend Church for 8 years of producing the GPS conference. We're just getting started. We're going to be back again tomorrow morning at 10 a.m. and all through this week, we'll have some fantastic presentations. We appreciate you joining us and spending your morning with us. We hope we'll see you tomorrow and all through the week. And once again, no matter where you are in your caregiver journey, we are all here to help you. There is never a wrong question. You should never be embarrassed to ask for help. That's why we're here, and that's why we do this. So please contact us and let us help you if we can. We'll see you again tomorrow, and we hope that you have a wonderful day, and thank goodness we don't have snow this week. So have a great day. See you tomorrow. Bye-bye, everyone.
Have a great one. Thank you.